In this video, you will learn about the procedural steps for performing male catheterisation, including the equipment required. This is an NHS Highland Practice Development Skills video adapted for UHI use. This video is designed to be used by student nurses in conjunction with a practical teaching session and directed reading. It can also be used as a reusable learning unit to refresh your knowledge and skills. UHI skills training attendance and competency assessment must be completed before performing this skill, and students should make themselves familiar with the relevant NHS Highland skills policy, which can be found in the policies library on the NHS intranet site. Before approaching the patient, perform hand hygiene, introduce yourself to the patient, explain the procedure including risks and benefits, gain verbal consent and check allergy status.
Identify and check the following: the patient's clinical need for catheterisation, the size of catheter required for clinical need, when the catheter was inserted, and how much water is in the balloon. Equipment required: sterile catheterisation pack, sterile saline 0.9% for cleaning, sterile lubrication gel, 10 ml of water for injection and syringe if no pre-filled syringe is included with your catheter, sterile syringe 10 ml for deflating balloon, an appropriately sized sterile catheter, a sterile drainage system, securement device, sterile gloves. Perform hand hygiene. Clean the trolley using a neutral detergent wipe and then wipe down with 70% alcohol impregnated wipes. Place all the equipment required on the bottom shelf of the trolley and take the trolley to the patient. Ensure patient privacy. Check patient's identity and allergy status immediately prior to the procedure. Ensure the patient is in an appropriate position and dignity is maintained if removal of any clothing obstructing access is required. Perform hand hygiene. Put on plastic apron. Slide the catheterisation pack onto the top shelf of the trolley. Then, using an aseptic technique, open the pack and other equipment required and pour the 0.9% sodium chloride into the galley pot, using an assistant if possible. Prepare the patient by getting an assistant to remove the towel and place the sterile sheet over the patient and a disposable pad underneath the patient. Perform hand hygiene. Put on sterile gloves. Using a sterile swab, hold the penis and retract the foreskin, and clean the penis with 0.9% saline or sterile water. Insert a single-use sterile lubricant which contains a local anaesthetic slowly into the urethra. Hold the penis for approximately 5 minutes. Dispose of the swab and take off your gloves. Gel hands and apply new sterile gloves. Attach the sterile drainage system to the catheter and slowly insert the catheter into the urethra. The catheter should be inserted almost to its bifurcation. Observe for urine. Inflate the balloon as per manufacturer's guidelines. Withdraw the catheter slightly, ensuring not to pull tightly, and secure with a device, for example a Clinifix. Attach the sterile drainage system to an appropriate catheter hanging gripper or catheter stand and place below the level of the bladder. Observe for urine and document volume. Help the patient put on their clothes and ensure they are comfortable. Dispose of equipment as per policy. Perform hand hygiene. Observe the patient for any adverse reactions and document and manage any complications. Clearly and legibly document the date, time, size, length and type of catheter and insert catheter label. Include reasons for catheterisation, amount of water in the balloon, volume of urine drained and any complications. Ensure insertion sticker and invasive device bundle are completed. Please ensure that appropriate PPE is worn when carrying out all clinical skills, including aprons. Aprons have not been worn during the making of these skills videos to reduce noise interference.